Sarah had been a med-surgical nurse for 8 years, navigating the complex terrain of hospital care with a warm heart but practical mind. She'd witnessed countless human stories unfold within the sterile walls of her unit, births and deaths, miracles and tragedies. But the patient who arrived on her floor that night would test the delicate balance between compassion and self-preservation that every healthcare worker eventually confronts. The patient's name was Madison, a woman in her 30s who tipped the scales at approximately 450 pounds. She had just undergone major surgery, her body still vulnerable and recovering. What made Madison different from most patients wasn't just her size, but her identity as a body positivity influencer with thousands of followers across social media platforms. The moment she arrived on the floor, her smartphone appeared, ready to document every interaction, every procedure, every face that entered her room. "I'm just sharing my journey with my followers," Madison explained, her camera already recording as Sarah entered the room for her initial assessment. "They need to see the real process of recovery." Sarah gently lowered the phone, her face kind but firm. "I understand you want to document your experience, but in this state, you cannot record hospital employees without explicit consent. It's a privacy law we have to follow." Madison's expression shifted from surprise to indignation. "But this is medical education. My followers need to see this." "I'm sorry, but all of us are declining consent," Sarah explained, noticing the disappointment flash across Madison's face. "We're happy to care for you, but we need to remain off camera." The tension in the room was palpable, but Sarah moved forward with her professional duties. Everything proceeded well until the inevitable moment when Madison needed to use the bedpan. Sarah had anticipated this challenge. It was a common difficulty with patients of significant size following surgery. "I need to go," Madison said urgently, her face flushing with discomfort and the beginning edges of embarrassment. Sarah nodded reassuringly. "I understand. Let's get you situated." She pulled out the bedpan, its plastic surface gleaming under the harsh hospital lights. "I'm going to need you to lift your hips slightly so I can position this underneath you." Madison tried to lift herself, her face straining with effort, but her post-surgical pain and limited mobility made the movement impossible. Sarah then attempted to slide the bedpan between Madison's legs, but the width of her thighs prevented the proper positioning. "This isn't working," Sarah acknowledged, her voice calm and judgment-free. "Let's try a different approach. If you can roll onto your side, I can place the bedpan and then you can roll back." Madison attempted to roll, her breathing becoming labored with the effort. Despite Sarah's gentle guidance, placing her hands carefully to help guide the movement, Madison remained immobile, her body seemingly locked in place. What concerned Sarah most was that Madison appeared to be making minimal effort, allowing herself to be dead weight rather than engaging her muscles to assist in the roll. "I can't do it," Madison finally said, frustration evident in her voice. Beads of sweat had formed on her forehead from even this minor exertion. Sarah stepped back, assessing the situation. "No problem. I'll find a few staff members to help us. With enough hands, we can safely roll you and get the bedpan positioned correctly." She stepped out of the room, the fluorescent lights of the hallway casting long shadows as she searched for available staff. The unit was busy that night, a cardiac arrest in room 512, a new post-op in 514, medications due for 5 different patients. The only person Sarah could find was Jamie, a certified nursing assistant who was 5 months pregnant, her small baby bump visible beneath her scrubs. Together, they returned to Madison's room. "I'm sorry," Sarah explained, "but we're short-staffed right now. It's just me and Jamie available, and we'll need more people to safely roll you. Jamie is pregnant, and I need to protect both her and myself from injury. We'll have to wait a little bit until more staff members are free." Madison's face darkened with indignation. "Why can't the two of you just roll me? I need to go now." Sarah maintained her professional demeanor, though she felt a twinge of frustration. "I understand this is uncomfortable, but we have to consider our safety too. Back injuries are the #1 occupational hazard for nurses. And with Jamie being pregnant, we simply cannot risk it." "So you're saying I'm too fat for you to help me?" Madison's voice rose, her cheeks flushing with anger and humiliation. That's not what I'm saying at all, Sarah replied evenly. This isn't about your size, it's about proper body mechanics and having enough staff to safely move any patient who needs assistance. I'm trying to ensure everyone stays safe. You included. I want to speak to your supervisor, Madison demanded, reaching for her phone. You're discriminating against me because of my size. You're hurting my feelings, Sarah nodded, stepping out to find her charge nurse, Elena. She quickly explained the situation, and Elena agreed to come help, bringing along another nurse who had just finished with a patient. As the team of 4 worked together to carefully roll Madison and position the bedpan, Elena addressed the situation directly. I understand you're uncomfortable, Madison, Elena said as they worked, but I need you to understand something important. Our staff's physical safety cannot be compromised, even if it means waiting for appropriate help. Your feelings are valid, but they don't supersede our need to prevent injuries. Healthcare workers have one of the highest rates of workplace injuries, and we have strict protocols to protect everyone. Madison remained silent during the procedure, but her eyes blazed with indignation. When they finished, she muttered, I still think you're being discriminatory. Sarah, maintaining her professionalism despite the accusation, responded calmly. I'm sorry you feel that way. If you'd like to file a formal complaint, I'm happy to provide you with the patient advocacy number. She knew from experience that these complaints rarely resulted in any action, especially when staff were following proper safety protocols. As her shift neared its end, Sarah reflected on the interaction. Had she been wrong to prioritize her safety and that of her pregnant colleague? Had she somehow failed in her duty of care? The weight of these questions followed her to the break room, where she documented the incident in meticulous detail. In nursing school, they had taught her about compassion, about healing, about putting patients first. But they had also taught her about boundaries, about self-care, about the reality that injured nurses cannot care for anyone. As she hung her stethoscope in her locker at the end of her shift, Sarah wondered what others would have done in her position. Would you have risked injury to meet the patient's immediate needs? Where do you draw the line between patient care and self-preservation? Share your thoughts in the comments below.